if you think about it, let's say your child has gotten about 8 to 10, viral illnesses a year. Some infectious symptoms can last anywhere from like as low as 3 to 5 days to 8 days to sometimes even 2 weeks. So I get a lot of questions from parents asking, when should I be worried? When should I be worried that my kid is having back-to-back symptoms?
All right, we're back.
Welcome everyone again.
All right, I'm Dr. Aniksha.
And I'm Dr. Deshna.
And welcome back to Those Millennial Pediatricians. This is a podcast where we break down common pediatric questions from families. So you may have heard our previous episode on respiratory season. If not, check out our part 1 for some introductory facts on respiratory season. But in the second part, we'll talk a little bit more about what you as a parent can do to prevent illness, how to treat illness when it inevitably may happen, and what else to look out for. So the first part we'll talk about is prevention strategies. So what can parents do to keep their little ones healthy during respiratory season? So first and foremost, we always say hand washing, hand washing, hand washing. So teaching your kids to wash their hands frequently, especially before meals and after being in public places, is really great. I feel like a lot of these COVID kids who were born during the pandemic are really great at that, and they reach for that hand sanitizer and they know exactly what to do. So some of your kids might already be on the ball, which is great. But especially if you have more than one kid at home, hand washing, covering their mouth when they're coughing or sneezing if they're old enough, is really important. And then really the most important thing too is just ensuring a healthy diet with adequate vitamins and minerals. And that's key to supporting their immune system in general, whether they're actively sick or not, in addition to obviously their growth and other things as well. I think we get a lot of questions about supplements in general, whether they're sick or not. So things like vitamin C, zinc, elderberry, colloidal silver, those kinds of things. So without getting too much into it in this episode for kids, there isn't really any strong evidence out there that taking any of these things will definitively reduce duration or severity of illness for children. If you look at some studies that are out there, a lot of them include adults or loop in kids of all ages. But the reality is that vitamin intake can vary by age group, and sometimes those side effects that don't present as severely in older kids might present more severely in younger kids. So there can often be a difference by age group. And I think importantly, supplements are not regulated by the FDA, so not all supplements are created equal. So that leaves a lot of parents trying to figure out what the best brands are, and there just are a lot of brands out there with a lot of fine print. Things like elderberry products made incorrectly can have cyanide alternatives, colloidal silver can cause organ damage, and taking too much of any one thing can lead to side effects like we've been talking about, including things as simple as vitamin C. So things like Emergen-C have a ton of vitamin C, and they can cause things like nausea and vomiting.
And just as an example, so for kids aged 1 to 3, the vitamin C recommended intake is about 15 milligrams daily, and then it kind of goes up by about 10 to 20 milligrams when you're ages 4 through 8 and then 9 through 13. At 9 through 13, you should be getting about 45 milligrams of vitamin C daily. In just one medium-sized orange, there's about 70 milligrams of vitamin C. So even if you eat like one orange a day for your older kids, they like already completely fulfilled their vitamin C intake. And so there are also other foods rich in vitamin C like bell peppers, strawberry, kiwi, etc. So tons of food. So you don't need much to fulfill your intake with the example I just gave. And this is exactly why we don't recommend supplementation, as over ingestion is very harmful.
So what we generally talk about is that adequate vitamin C and zinc in a diet are important to a strong immune system, and they generally help in preventing illness. And this is where a healthy diet is key. So if you have any questions about things like supplementation, the best thing to do would be to talk to your pediatrician about your child's specific health and any trusted supplement brands you're interested in to see if there's any concern for vitamin deficiencies. And then they can always talk to a nutritionist too, if that's something that you're concerned about too.
Next thing I don't want you to forget about is vaccination. So the flu vaccine is a great way to help protect your child against the flu, as well as the RSV antibody for infants in their first respiratory season, which we already talked about in our first part of this 2-part episode. So if you want more information on what that is, I recommend you go back and listen to that section in part 1. And then finally, of course, it would make sense to limit exposure to other sick kids because things get passed around like candy. But we know this is kind of next to impossible when kids are young, grabby and love to play with other kids. So just try your best. Hand washing is probably the best. And then avoiding them being around other children when they're like actively coughing and fevering is also not the best idea, but do what you can. The next thing we want to talk about is some home care tips. So as much as you can try, sometimes the inevitable happens. They get sick, they bring something home. And it's inevitable that they'll probably pass it along. So if your child does catch a respiratory illness, what are some home care tips? So number one, keeping them hydrated is crucial. I encourage lots of fluids, so water, soup, even electrolyte drinks if they have a fever. And then it's important to note kids under 1 year old should not be having juices, orange juice, apple juice. So just wanted to make that clarification. And then rest is also super important. So creating a cozy space where they can relax and recuperate. Sleep is very important. For congestion, nasal saline drops can be helpful to draw all those secretions and congestion out. And then using a humidifier in their room can help ease up breathing. I always say if you don't have a humidifier in your house, it's not the end of the world. Steaming up the shower and having them stand in there in the bathroom can work just as well. And then the nose Frida is going to be your best friend. It's kind of like what we call the snot sucker. So it can suck all the snot out. Also, if you go to our Instagram and TikTok, we did do a short video on what, over-the-counter stuff you can use on, buy at CVS or Walgreens or any pharmacy for all of these like home care tips. So check that out too. And then to move on, so cough. Usually I don't really recommend like cough medications for younger kiddos. So for that, if they're older than 1 year, they can get honey. That kind of helps ease the feeling, the tickling feeling, and it coats your throat and helps make it less sore. You can use Vicks VapoRub. And older kids can get Tessalon pearls. I know, Aniksha, you said you've prescribed that or kind of recommended that to older kids, but I had to look up like the actual drug name because sometimes I get those intermixed, but essentially it's called benzonatate. So it's just a big fancy drug name word, but essentially what it does is decreases the cough reflex. So it's kind of like a quote unquote local anesthetic, and it suppresses the vagal nerves around the lung. So the nerves that are responsible for making you cough when there's any irritation or inflammation, it kind of suppresses that. This is not recommended for kids under 10 years old. So it's really only for the older kids if they really, really need it.
Yeah, I feel like the settings that we've seen it prescribed in or we've prescribed it in are typically for the older kids who are doing much better. They don't have a ton of mucus or anything that they need to cough up, but they have that post-viral cough that just won't let them sleep and they just can't sleep at night. And so we give this more for symptom relief. But if you have a kid who's actively coughing up mucus or is actively sick, not doing well, we want to make sure that we're not just suppressing their cough when that might actually be helpful. And of course, like Deshna said, not giving it to kids who are too young.
And then my last my favorite natural remedy is turmeric milk. It's thought that the active compound in turmeric is called curcumin, and that can be anti-inflammatory and that can inhibit what we call cytokine release. That's just a fancy word for like the signaling molecules responsible for inflammation in your body. So there's thought to be a role. But of course, it's not to replace antibiotics when needed. So I want to make that clear. It's a natural remedy, but not as like an actual medication. It's very comforting and it's thought to be helpful in these situations.
Yeah, whenever I was sick, that was the first thing my mom whipped out. And I was not a big milk drinker, so it was not my favorite thing. But I did feel like it made me feel better. And despite common belief, milk does not increase your mucus production either. So drinking milk when you're sick is actually okay. But for those of you who don't like milk, what I do now, which is my adult version of this turmeric milk, is I mix turmeric powder in honey with some ginger too. And that I just take that as is when I have a sore throat. Okay, so like we said earlier, your child can have up to 10 illnesses in a respiratory season. And again, doesn't necessarily mean that something's wrong, but sometimes it can feel like they're getting hit back to back by illnesses or that they've never recovered.
Yes, so if you think about it, let's say your child has gotten about 8 to 10, viral illnesses a year. Some infectious symptoms can last anywhere from like as low as 3 to 5 days to 8 days to sometimes even 2 weeks. So with all those infections in the year, it may seem like they've been sick forever or are just always sick. And that can be worrying for parents. I totally get it. So I get a lot of questions from parents asking, when should I be worried? When should I be worried that my kid is having back-to-back symptoms or back-to-back illnesses? The reality is we rarely see back-to-back illnesses as a sign of something dangerous or rare, like an immunodeficiency. But sometimes we do get concerned or are at least thinking about immunodeficiencies when we have the following scenarios. I'll just, kind of summarize the 4 or 5 most common situations. So one is failure to gain weight or grow normally, or if they have, repeated chronic diarrhea for months and months. And we'll usually check this at their well-child visits. We'll look at their growth curve and make sure they're gaining weight. The second scenario is they're having like 6 or more ear infections in 1 year requiring antibiotics. 2 or more bacterial pneumonias within a year, also requiring antibiotics. And then the last scenario is infections, whether it's in your lung, your ear, or you have skin infections that are not responding to oral antibiotics and you need repeated IV antibiotics for treatment or admissions to the hospital. So, if any of those apply to you or, just as a scenario, those are the times when we would kind of think about illnesses a little bit more. But it's natural that illnesses during the winter time will just go around and everyone will be coughing and sniffling for months at a time. Yeah. So don't be super alarmed about that.
Yeah. But we'll definitely talk a little bit about when you should consider calling the pediatrician. So like Daisha was mentioning, the typical constellation of symptoms or a typical viral illness in and of itself or a fever isn't really necessarily a sign of concern with most of these cases. And again, like we mentioned in the first part, these symptoms typically resolve in about a week to 2 weeks or so, depending on the symptom itself. But let's talk a little bit about some of the things that you might want to talk to your pediatrician about. So the first one, which I think we've mentioned in the first part as well, is if your child has a high fever that doesn't respond to medication or continues to go up instead of improving. So that's, you see your kid getting like a 104 fever, and then the next day it's 103, 102, maybe 100 normal. That's what we typically expect to see. If you're seeing 104, 104, 104, or 102, 103, 104, 104, those are signs that you might need to talk to your pediatrician, and maybe something else is going on. It might not just be your typical viral illness. There are some viral illnesses that do this, that can cause a particularly high fever, but still it's something you might want to consider. Another one is if your child is feeling excessively tired or lethargic. So obviously they won't feel great during this time, but they'll still be able to like get up and drink and slowly gain some energy. If they really just don't seem like themselves, and that's where your parent intuition will kick in, that's a time to talk to your pediatrician as well. A third one that we talk about a lot is signs of dehydration. So not urinating a normal amount, no tears when they're crying, or they're just not drinking anything, and that's showing in the way that they're not peeing at all. That's really key, and they might need some help in terms of fluid support. Another one we've talked about a bunch of times is also difficulty breathing, so that's your respiratory distress, or if they're showing up to the pediatrician's office and their oxygen saturation just isn't in the normal range. And another one is if they have any other medical problems that put them at high risk. So a big one that we see a lot is asthma, or if you have asthma, that puts your kids at risk for maybe having some sort of those issues. If they have eczema or food allergies or other allergies, those are things that we call atopy, and it just is a sign that they might react a little bit more when they get sick in terms of their airways. And then finally, if the symptoms persist for more than a week, or if they worsen instead of getting better, that's a time to talk to your pediatrician. And I think also just in general, even if it is a viral illness, if there's something that makes you nervous or something you have a question about in terms of taking care of your kid, that's what we're always there for. There's no pediatrician that wouldn't love to talk to a parent and just either reassure them or have, their patient come in and just see them, lay eyes on them, make sure everything's going okay.
I sometimes find a lot of parents like hyper focused on the exact specific number that, fever they had, which is like, oh, they had a 103, like 102, whatever, fever. But then they're running around, they're playing, they're drinking and eating. That's usually less worrisome for us, unless obviously it's one of the reasons that Aniksha mentioned that it's continuously happening for 5 days or more. But generally, if they're well appearing, but they're having these fevers and they're going down, everything's going to be okay. So try not to, hyper focus on that number. I know it's hard, but take-home message if you're going to take anything home at all. To wrap this up, we hope the second part of this episode was helpful in clarifying respiratory season, what to look out for, and general prevention tips for making the season more manageable for your family. So to summarize a few points that we talked about, prevention strategies like lots of hand hygiene and supporting the immune system with vaccinations will set you guys up for hopefully relatively uneventful respiratory season.
So lots of the home care tips that we already talked about, whether those are kind of over-the-counter fever-reducing medications, creating a cozy space for rest and recuperation, or other sorts of natural remedies that you might use culturally, in addition to suctioning, ways to relieve congestion, and hydration.
And when to worry about frequent infections include multiple significant bacterial infections in a year and difficulty gaining weight and following their growth curve throughout the years.
And finally, when to seek help if you're not sure when to, significant dehydration, worsening symptoms not resolving within a week, and things like difficulty breathing.
I hope this two-part episode was helpful for everyone. Again, feel free to leave, comments either on our Instagram, our TikTok, or feel free to reach out on our email that's available on this Spotify description episode for more feedback, and just, feel free to leave more recommendations for topics on things you would like to hear. We have actually a lot of good topics lined up, but obviously we're open to recommendations. And with that, we'll see you at our next episode.
Happy, healthy respiratory season. Bye.
Good luck. Bye.